Hello and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today we are going to explore connecting with nature and what a powerful tool it is, how accessible it is, how cheap it is, and most importantly, how effective it is. My guest today is Dr. Jenny Brockis. Now, Jenny is a medical practitioner and a lifestyle medicine physician. She connects to what matters, simplifying the complex and getting the most out of life and work. She's a speaker, she's a trainer, and an author. She's written 4 or I think 5 books, and we talk about many of them in this podcast. Forever curious, she is passionate about people, performance, and about being practical. Her purpose is to inspire positive change that makes work better for everyone. I hope you enjoy this conversation I had with Dr. Jenny Brockis. Welcome to the show, Jenny.
Thank you for having me, Ron.
Jenny, there's so much we want to talk about today, and I think we kind of have a lot in common, philosophically anyway. I was really struck by the fact that you describe yourself as being cautiously optimistic and at the same time a fierce advocate for health reform. And sometimes when I think about health reform, optimism isn't really the word that I'd use, but I love it. Tell me why you are cautiously optimistic, or maybe, and also, I know, fierce health reform. Tell me what you think the problem is and what we need fixing.
Okay. So I've been working in the health and wellbeing space since 2009, helping people at work to do work better, but also to feel better about themselves and to manage their stress more effectively, et cetera, et cetera, et cetera, et cetera. And at first it felt like I was a lonely figure on top of a mountain shouting into the wind, not making much difference to anybody in particular. And then in 2014, I think it was, I fell over lifestyle medicine, which has actually been in Australia for over 20 years, but became sort of created as a society here 10 years ago. And I thought, these people are talking the same language as I talk. They're talking about going back to the basics of what keeps us well. What can we do to prevent illness and disease? And I thought, this is music to my ears. And coming from medical practice, because I worked as a GP for many years, where you're very much reactive, you're responding to illness and you're putting the Band-Aid on, hoping it doesn't fall off before they get home, but knowing that in a short time, they're likely to come back and need another Band-Aid. So my optimism is that I sense that there's a growing desire within the health profession itself. And I'm not talking just about doctors. I'm talking about all the allied health practitioners who see that the existing healthcare system is no longer fit for purpose. It was fine when it was designed, but it doesn't fit what is needed today. And I think the other aspect is that our clients, our patients themselves are looking for a different way of applying health. They want to have more autonomy in their choices and their decisions. They want to drive what they need to do to stay well, not just for today, but for the next 20, 30 years. So I am cautiously optimistic because I sense the wind of change. But anything to do with change within the healthcare system, as we know, is notoriously slow. And we can keep banging our drum, singing loudly from the rooftops, but it just takes time. So I think we just have to adopt the long-term approach and know that politicians never work like that. They always want the short-term gains that make themselves look good and just chip away at it, because I think the undercurrent of desire for change from the health profession and from our clients is what's going to bring it about.
Yeah, no, I share that. I actually, when you put it like that, I share the optimism, because if I think the optimism for healthcare reform is going to come from the healthcare industry, I'm filled with dread. Paradoxically, but consumer-led, yes. And I think there's another interesting area which I think you're involved in too, and that is the workplace.
Very much so.
As the place where I think there's a confluence of interest.
Definitely.
that not only does good health make sense, but it also makes dollars, which is ultimately what speaks.
Yes.
So this is an area, but I'm intrigued to know too, Jenny, and I hope I'm getting this right, is that you came into this area in 2009, but I'm guessing you were a doctor for a few years before then.
Absolutely.
Yeah. And what was that like?
It was great. I mean, I trained in the UK. I migrated to Australia with my husband because he was headhunted by a company here. And I'd always had the idea of setting up my own general practice, which in the UK would be almost impossible to achieve. But I was able to do that here. It was magic, absolutely magic.
Yep.
And I was able to practice medicine in the way that I thought it ought to be practiced.
Nice.
Patient-centered, giving people the time that they need to be fully heard and understood, and making sure that it was a journey we undertook together to get them better. But I did become increasingly frustrated by, the push to always see more people more quickly, the fact that we were never getting to the nitty-gritty of what was leading people to become unwell. And I also developed the realization, as you've just alluded, that much of the illness that we were seeing was coming from this place we call work. People were stressed to the max by unrealistic deadlines, taking on too much, being driven to do more than was actually humanly possible, and suffering the consequences of chronic disease. And as I'm sure you're only too aware, and your audience are, we live in an era of chronic disease, and so much of this is preventable. And I think you're right in that the workplace has been overlooked as a potential conduit of change. But over the last 5-10 years, there's been this real drive. Employers, HR professionals are saying, what can we do to enhance health and well-being in our staff? Because they actually do get that a happy, healthy person at work is going to be more productive, more effective, and likely to stay at that particular workplace for longer. Makes sense. So that's
Yeah. I know you're in the West. You're in Western Australia. I'm
Yes.
in Eastern Australia
Yes.
for our overseas listeners, and I know in our eastern states that has actually been legislated very strongly. There's you have to legally now. Employees must mitigate the psychosocial risks
Yes.
in the same way that they would have to mitigate the physical risks of employing someone. And there are fines now. So I believe there's never been a better time to be an HR person, because all the things you've ever told your employer needed to be done now have to be done.
Yes.
But it's interesting about the workplace, because we were talking about this just before we started, that talk about a workplace that breeds ill health and pressure. Healthcare professionals are some of the worst.
Unfortunately, you're quite right, Ron. And I really am so concerned about what we are doing to some of our youngest and brightest who are entering healthcare as a chosen profession. And yet the system grinds them down, often before they've even had a chance to graduate and get out and practice what they've learned. So I think there's much to do in our own house first, because I strongly believe that unless we are well in ourselves, how can we possibly help other people? And I think a health practitioner always comes from that place of service. We always want to make sure that we are doing our utmost to help the other person. But if they see us as tired, stressed, overwhelmed, they're going to be thinking, well, that person clearly doesn't take much care of themselves. Why should I listen to anything they've got to say?
Yeah, I think philosophically too. I mean, one of the things I've observed as a holistic health practitioner and knowing many integrative doctors is the thing that integrative doctors and allopathic prescription-based doctors have in common is they want the best for their patients. Both groups want the best for their patients. But I think there's a philosophical difference. If you're unwell as a health practitioner, you are into just managing health, managing the symptoms of yourself and therefore of your patients. Whereas if you are feeling good and know you can feel good as a practitioner, you want to impart that to your patients.
Exactly right. And I think this is where the fundamental shift in mindset needs to take place, so that more of the allopathic practitioners see what's possible. Because at the moment, I'm hearing all the obstacles, all the reasons why it's just not practical, why it just can't happen. And I'm saying, oh, yes, it can, because it is already here. Practitioners are already doing things differently so that they are really embracing and enjoying their lives and their work and imparting what they have to their patients. So it's a win-win for everybody.
Yeah. No, I couldn't agree more. Music to my ears. Listen, you've written a book. You've written a book called The Natural Advantage.
Yep.
And it takes a holistic approach. And one of the words that I love, and I'm going to say very slowly, it's a holistic approach that includes all the bio, psycho, social, environmental factors like time in nature. And I love, when you break that down, actually, when you put hyphens between each one of those, it makes total sense. But when you say it too quickly, it's not. But go on, let's break it down a little bit here. Tell us about the natural advantage.
So I wrote The Natural Advantage because I came to the realization, and I think COVID played a part in this, that we are so caught up in the busyness of everything. We've forgotten just how important it is to get outside, even for a short period of time. Busy lives, we don't take the time to think, let's go down the park, let's quick a footy round the field with the kids or anything like that. And I was struck by the research, which clearly demonstrated that we are missing out on the best medication the planet has to offer.
Yes. I think that is a statement that should be in capital letters on every house or every go on. Music to my ears. Yeah. Keep going.
So, we have a situation where 1 in 7 Australian adults is taking a prescribed antidepressant. Some of those people can't get off their antidepressants for whatever reason, and that's a different subject on its own.
We've covered it. Jenny.
Oh, have you? Good.
We have.
Good.
We've covered it big time on this. Go on. Yes.
And intuitively, I think people understand that getting outside for a walk or a run or something where you've got a green outlook or a blue outlook fundamentally makes us feel better. But I wanted to drill into the science and reveal why that is so, because I think sometimes we need the scientific proof. It's all very nice to have that feeling, oh, this is great. But if you understand why we're feeling great and how important a difference it makes to our health, then it gives us every reason to get outside more. So the book is really to encourage each and every one of us, even if we've only got a couple of minutes every day, to step outside, feel the air on your skin, sunshine, and just enjoy what nature has to offer us. So I in the book, I approach it from the elements, air, wind, water, earth, and all these sort of benefits to health it provides in terms of mental health, emotional health, cognitive health, immune health, social health. So that very long word that I shared with you, which was a bit tongue-in-cheek when I did, I have to confess.
Yes, I'm sure it was. Yep.
It really encapsulates that it's not just one thing that being outside helps us with. It's everything. And it almost seems too simple. And it is simple. But let's not forget that sometimes it's the simple things that can have the biggest impact on how we are as human beings.
Well, let's break down a little bit of the science. I mean, apart from feeling good and, we've been told to do that, I mean, there's actually a biology, there's actually a physiology, there's a biochemistry.
Absolutely, there
behind
is.
it.
Yes.
Which tell us a little bit about that.
Well, I think that dates back to the 1980s when the Japanese first introduced Shinrin-ryoku, or forest bathing, to the world. Well, they introduced it to the businessmen, actually, in Japan, because they recognized that the work ethic there was actually creating a high level of stress and in many instances leading to heart disease. So it was believed that by taking these stressed businessmen out into the woods and letting them just roam around on their own for a little while would make a difference. And so the scientists went out, measured their blood pressure, their heart rate variability, cortisol levels, etc., and found, yes, indeed, it does make a significant difference and did help to not only lower stress, so mentally they felt better, but it also made a significant difference to their physiological health as well. So that was the first part. And then I think the other study which blew my mind was Ehrlich back in 1984. And again, it's not recent studies. I mean, this has been around for a while, where he showed that patients recovering from gallbladder surgery, if they were allocated a room on a ward where there was a window overlooking a green space versus a room on a ward with a window overlooking a brick wall, there was a marked difference in their recovery in terms of speed of recovery, in terms of the amount of pain medication required during that time, and also what the nurses reported to the patient's demeanour during their time in hospital. So people got better faster, they spent shorter times in hospital, and they felt better too. So win, 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 win. And so that really intrigued me as to, really? Could looking outside a window really bring about all that change? And then, of course, we've had beyond Ehrlich, who sort of talks about stress reduction. We've had the Kaplans who've introduced their theory about attention restoration, and that today in our busy lives where we spend so much time indoors looking at a screen, mentally exhausted, going outside, just, again, you get that physiological response, you activate the parasympathetic system, so you feel, oh, that's better. But also it starts to restore attention because you're adopting a softer, what they call a fascinational gaze as you look around you, broadens your perspective. So it's interesting. It sharpens your focus while also providing you clarity in your thinking. And I thought, oh, I like that. I like that very much.
Yeah, lovely. Okay. I'm sure there's more.
Oh, there's plenty more.
Okay, go on. I love it. Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. So forest bathing, Ulrich, and looking out to nature, and Kaplan's attention restoration, which, I mean, keep on going. This is good.
So I think the other thing is that it was realized that while getting out into nature is the best, it's the real deal, we can do other things if we don't have the ability to get outside. And this is something I think is really important. There are those of us who live in situations where you might not physically be able to get outside, or you might live at the top of a tower block and you've got very limited access to anything green around you. This is where what is called biophilic design comes to play. Now, biophilia was a term introduced initially by Ehrlich and then made popular by E.O. Wilson, which is really describing our innate affiliation to nature. And it's stronger in some of us than others. Some people are like, oh, don't give me that nature stuff, all those wrigglies, I don't like it. But other people realize that, it is important for us and our well-being. So for me, it's about health equity and how can we enable everybody to have better access to green spaces. This is where urban planners come to play by providing, good urban design with lots of parks and trees and shrubs so that people can get access to greenery easily. Workplaces can introduce biophilic design into the workplace, those beautiful living walls that you sometimes see that are covered in ferns and mosses that invite you to sort of reach out and touch, or simply living plants interspersed around the place can make a big difference to how we feel, been shown to boost productivity as well. So workplaces like that, of course. Simple things like putting a nice picture on the wall, something natural, or painting your room sage green or a similar natural colour, or having access to something that's tactile, something you can touch. It could be a wooden ornament or something like that, or polished stone. All these things induce that sense of calmness and feeling good.
Now, one of the things, probably I think, well, I don't want to give too much away, but a public health message that I always think is an interesting one is to stay out of the sun, the demonization of the sun. What's your view of that?
I think we've got to get the balance right. I think we've done a fantastic job with the Slip, Slop, Slap campaign to minimise the harm excess sun can do to our skin. I mean, nobody wants to see skin cancers or premature aging and things like that. However, we've probably taken it a bit too far because some people are now so scared of the sun, they don't go out, or when they do go out, they're covered from head to toe and there's no ability for their skin to access any beautiful natural sunlight, which of course we need in order to manufacture vitamin D in our skin. So I think we've just got to get smarter in understanding that sunlight gives us life. I mean, if there was no sunlight here, we wouldn't be here having this conversation today. We would have long perished. But I think, understanding that sunlight is so important for certain aspects of our health, mental health. So many people, I was brought up in the UK, and a lot of people in those latitudes suffer from seasonal affective disorder, where you've got low grey skies. It's always a bit miserable. It's always a bit rainy. And it's like, ugh. We need that natural sunlight to give ourselves a natural boost. When we go outside, even for 10 minutes or so, we get a nice little top up to our serotonin levels, which, of course, we naturally produce mostly in our gut. But it just gives us that little bit of a boost. And you think, oh, I feel better now. So that's the reason behind that. We need sunlight, of course, for vitamin D, which is so important for so many different biochemical processes in the body beyond bone health, but also for our cognition as well. So I think it's about educating people to understand that, it's not a good idea to go out at 2:00 in the afternoon and sunbake for a couple of hours, wearing your incy-wincy, tinsy-wincy polka dot bikini, but to get the balance right and understand that getting out into natural light, especially the early morning sunlight, is really good for us. You don't need sunscreen at that time. You get the benefit of that early light, especially resetting our circadian clock, so we actually enhance our sleep patterns as well. And also we give ourselves a chance to manufacture a little bit more vitamin D.
Yeah, look, it's so interesting to hear you focus on this natural advantage because, again, bringing us back to our geography, you were in Western Australia where, although during COVID, the state was literally cut off from the rest of the world, but life went on normally, did it not? I mean, you were just basically going out, doing whatever you wanted to do, whereas in the East, or were you? Am I romanticising it?
It was certainly easier here than over east, and particularly in Melbourne.
Yes.
But we were constrained for part of the time. We weren't allowed to sort of go out unless it was essential. You had to go and buy food. But we were given sort of permission to go out for an hour of exercise every day.
Oh, really?
Yes.
I didn't even know you had that.
Yes, we did.
Okay. Isn't that odd, though? I mean, here we are talking about the benefits of the natural advantage to our immune function and mental
Yeah.
health. And one of the biggest public health messages was lock down and don't go outside.
And that did so much damage to so many
So
people.
much damage.
So much damage, especially in terms of loneliness. And even now, we're seeing the aftermath of that. And this was predicted at the
Still.
time.
Yep.
Particularly in our younger generations, we tend to think of loneliness as something that only affects older people. Not true.
Yes.
And I think, our urban environments contribute greatly to that. And if you're not allowed out as well, you can't interact with people. And we're social creatures. We need that face-to-face interaction, even if it's just walking the dog and you cross paths with somebody else and you lock eyes and you maybe give them a smile and say, good morning, or whatever it is you say. We need
absolutely.
that. We really do need that. Yeah.
It's without being too controversial, I think it's a shocking reflection on public health officials, but that's another story. Listen, you've written a couple of other books,
Yep.
Brain Fit, Brain Smart, Thriving Mind, and Smarter, Sharper Thinking, and you talk about 12 keys to improving mental health. I guess we've covered a couple of them. What would be those 12, what are some other things that we haven't spoken of?
I guess some of the other things are first, healthy nutrition. Healthy nutrition is a passion of mine. We've made eating such a complicated business for a variety of reasons, through all the marketing, through all the advertising that we get inundated with every day. And I think it's led to so much confusion. People don't know what's true, what isn't true, what's right, what's not right. And so I think they just give up, just do their own thing. But I think it's very clear that the research does show that following a more natural diet, a healthier diet, which is whole food based, with minimal processing, locally sourced, has got to be the best way. And the Mediterranean style of eating has been the most researched pattern of eating. It's not to say it's the be all and end all, but it's certainly up there, indicating that, following the first rules of eating more fruit and veg, eating some lean protein, plenty of good extra virgin olive oil, seeds and nuts, fruits and berries, all those sort of things make a positive difference to our mood as well as our mental health. And I always stress this when I'm talking about how to improve mental well-being in the workplace. And I say, well, what are you doing? What are you eating at lunch if you do stop for lunch? Because so many people don't.
Yes.
And it's often grab something on the go, often not aware of what you're eating, putting in your mouth, got no recollection of what it was or what it tasted like. And I think if we just give ourselves a little bit more space to think, well, what am I actually putting into my body and how is this going to support me to feel better, to function better, is absolutely vital.
Yes, well, that natural diet, that Mediterranean diet, well, there are so many different diets for people to choose from, really, aren't there?
Yeah.
But towards the end of this year, we've done quite a few programs, as we have over the years, on a low carb approach to eating, and I would say that is underpinning a lot of problems that we see in our society too. Diabetes, insulin resistance seems to be bad for whatever you've got: heart disease, cancer, autoimmune, mental health.
Definitely, yes, definitely.
Yeah,
and it's really interesting to see that research come out and to see so many practitioners now offering diabetes reversal programs using diet.
Yes.
And it's achievable. And of course, when people understand the power of what changing your diet does for you, I think people really sort of start to take it on board. And that's how the message starts to ripple out and we get societal change in attitudes. Yeah.
We've done so many programs with doctors who had been telling their patients all their professional careers that type 2 diabetes was irreversible until they themselves got it. explored a low-carb approach. Well,
Yeah.
this is true. Explored a low-carb approach and turned not only their health around, but then went on to turn around the health of so many of their patients, which brings us back to what we were talking about at the very beginning, wasn't it?
It was indeed. And I think it's true. I mean, we get taught to think in a certain way. I mean, I went through medical school and I was taught this is the way it is. This is what you have to diagnose. This is how you manage things. Go forth and be a good doctor.
Yeah.
The practice, of course, is always somewhat different. And you start to realize that we're not all the same. You can't apply a one-size-fits-all blanket approach because we're different. It's like the difference between men and women. Hate to belabor a point, but there is a small difference.
There is. Yes, you could. Well, be careful. Be careful. You could get cancelled for saying something as controversial as that.
Well, I think it goes back to understanding that, a lot of the information I was taught was based on research that had been done on men only.
Yes,
And
because women are too difficult to do research on.
well, that's right, because we have awkward things like periods. But,
yes. Well,
did I mention that word? Oops. Yeah. Anyway.
Yeah, but that's true,
but
isn't it?
True.
I mean, most of the research has been done on men for that reason.
And particularly in the area of heart health, and heart disease is a major issue for women, particularly once they've been through menopause. And most women are totally unaware of that they are at increased risk. They don't know the difference in symptomatology of what to look for in themselves, because we've all been taught the classic, somebody having a heart attack is somebody who's middle-aged, male, clutching their chest and going, ooh, and falling backwards. And that's not necessarily true if you're a woman. So I think we've just got to realise that, let's treat.
What would be some of the symptoms that a woman should look out for, if they were having a heart attack, that are different from that stereotype?
I think the thing is to recognise if there's been a change in your level of fatigue. So many people are tired all the time, but if you suddenly get excessively tired and you're a bit short of breath and you're thinking, oh, what's going on? Am I going down with something? Am I getting a virus? That could be an indication. It could be feeling a bit nauseous, thinking, oh, eaten something, don't know. They can be very vague. They can get pain in the chest or elsewhere, but it's vague symptoms that they just put down to, oh, I've just been doing too much. I need to step back a bit, rather than thinking, this is not me. This is not normal. Perhaps I should just go and get it checked out. Because the other thing is, women don't always show the same changes in blood work if they're having a heart attack. So they don't get the rise in troponin levels to the same degree as men do. So the treating physician will be saying, oh, you don't seem to have been having a heart attack. You're okay. So we know that women get diagnosed late or misdiagnosed. They are less likely to get admitted to coronary care units, and their outcomes aren't as good because they're not receiving the same level of treatment that their partners might do. So it's interesting, isn't it? But it is changing because we're now aware that people present differently. I mean, I guess the classic is appendicitis. We're always taught that can mimic anything, which is true. And I think we just have to be aware that in a number of ailments, we tend to get given the classic view of something, but we have to have that flexibility and ask, this doesn't quite fit. What else could it be?
Yeah. Well, listen, we'll of course have links to your website and all your books and they're wonderful things. I wonder if we might just finish with this one question. Taking a step back from your role as a doctor, as an author, as a speaker, because we are all on a health journey through this modern world as individuals. What do you think the biggest challenge is for us as individuals on that journey?
I think the biggest challenge is to recognise that it's what we do consistently on a daily basis that is going to determine not just how long we live, but how well we live. I think we owe it to ourselves, to our partners and to our families to really put in place those choices that we can make that are going to optimize our health and well-being, and not wait until we think we're getting older to start. This is something that we need to be encouraging our children to get involved with, so they are better placed, because we're seeing this rise in chronic disease in our younger generations. They are going to live shorter lives than the baby boomers. And we need to do something to address that and ask, why is this happening? What can we do differently? And the key to it is to say, if we're living in a way that doesn't serve us, that is actually contributing to our risk of becoming unwell, because we're living with too much stress in our system, which promotes more inflammation, which promotes the potential for other disease and illnesses, then we've got to go back to the beginning and say, okay, what can I be doing differently to prevent that?
Yeah. Well, that's a great note for us to finish on, and a great message to impart to our listener. Jenny, thank you so much for joining us today, sharing your knowledge and wisdom with us, and the wonderful books that you've written, which we'll, of course, have links to. Thank you so much.
Well, thank you, Ron. It's been an absolute delight to be with you.
Well, there it is. It's accessible, it's cheap, it's out there for us. We've evolved with it, nature. And while we might congratulate ourselves on being modern and sophisticated and all of that, we're still walking around with our Paleolithic, in fact, pre-Paleolithic bodies and minds. And we really need to reconnect with that has made us what we are today. So we will have links to Jenny's site and her books. I think that is there are some great messages there which certainly resonate with what we talk about on Unstress Health. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.